And I'm going to only briefly share my screen. And
Becky,
then
I apologize. Would I just select present now to share my screen when I'm ready?
you'll go down to present now, and then you will click on a tab, and then you will select your tab.
Okay, thank you.
Sure. Here we go. I do believe we are recording. Hello, and thank you all for joining us for this Blue Cross Blue Shield presentation for your APS benefits. My name is Becky McGregor, and I'm your APS Employee Wellness Coordinator. Joining us today is Lisa Guevara from Blue Cross Blue Shield. Thank you, Lisa, for joining us and giving this wonderful presentation. We also have Ann Johnson and Andrea Biggs on the line to answer questions in the chat box. I want to go over just a couple of house cleaning items. We want to limit distractions as much as possible. Please turn off your microphones and your cameras during the presentation. If you do have a question, please put it in the chat box. And our benefit specialists, our Ann Johnson, our senior analyst, will be able to answer that for you. We do have a Q&A session at the end, and we also absolutely ask you to ask any questions you need to ask. And if there's anything that's specific to your particular situation, we might ask you to hold off with us till the end after we're recording so we can answer those specific questions for you and meet your needs. And without further ado, I will stop sharing my screen and Lisa can share hers.
Okay. Thank you, Becky.
I just want to, I'm sorry, go ahead.
Please let me know if you can see my screen.
Yes.
Okay, wonderful. Good morning, everyone. My name is Lisa Guevara with Blue Cross Blue Shield. It's a pleasure to be with you this beautiful fall morning. You may notice I have my my blinds closed today because I'm fortunate enough to live close to the Rio Grande, and there are probably about 10 to 20 hot air balloons behind me out my window. So I didn't, Becky asked us to limit distractions, and I know for myself it's a huge distraction for me on a beautiful morning like this. So again, it's a pleasure being here. Welcome to Open Enrollment, discussing our benefits with Blue Cross Blue Shield for January 1st, 2022. What a year this past year has been, and it's a pleasure to be able to continue to be a partner with APS and discuss a little bit of the enhancements and tools and resources that you have available to you with Blue Cross Blue Shield. Today, we're going to cover a little bit about the Blue Cross Blue Shield of New Mexico plan features. We'll discuss customer service as well as online tools and resources, and we will finish up, most importantly, with all of your health and wellness programs that are available through Blue Cross Blue Shield. So first of all, I would like to talk a little bit about why Blue Cross Blue Shield. With Blue Cross Blue Shield, you have access to the largest network of contracted doctors throughout the United States as well as internationally. With Blue Cross Blue Shield, you do have a PPO option. This gives you access to more than 1.5 million providers and over 9,000 hospitals throughout the United States. Over 83% of doctors and 96% of hospitals are contracted with Blue Cross Blue Shield and are included as part of your network. Once again, that network is nationwide, so wherever you go, your coverage goes with you, not only nationwide, but as well as internationally as well. We have Blue Cross Blue Shield providers contracted with over 190 countries and territories throughout the world. A little bit about how your PPO plan works. With the PPO plan option, you have the flexibility and choice to select the providers that you feel are most appropriate for your care. You have both coverage for in-network as well as out-of-network providers. Out of network indicates that these are providers that do not currently have a contract with Blue Cross Blue Shield. But we highly encourage you, because we have such a comprehensive PPO network, to try to stay within in network. When you stay in network, you receive the highest level of benefits and potentially pay less for your care. You are protected from balance billing. And what that means is that for any services or charges that may be over the allowable amount, you will not be charged for those by contracted providers, as well as contracted providers give you the convenience of filing all your claims on your behalf. So there's never any type of administrative work on your part. They handle all of that for you. In addition to that, as long as you're seeing a Blue Cross Blue Shield contracted provider, there are no referrals required, as well as you are not required to select a primary care doctor. With that being said, it's important to realize that although you do not require a referral from your primary care doctor to see any specialist, sometimes specialists, particularly dermatology or perhaps orthopedic providers, they do request a referral from a primary care doctor, just as a courtesy to make sure that your primary care doctor is aware of your situation and feels that it's appropriate for you to see a specialist. But once again, it's not part of your program with Blue Cross Blue Shield, and we do not request any type of referrals. Again, as I had mentioned, you do have the flexibility to seek services from out-of-network or non-contracted providers. You do have coverage, but you may pay a greater share of the cost. You may also seek services that may not always be covered out of network. Perhaps it's a transplant service, as an example. And you may be requested by that provider to file your own claims. Most importantly, it's important to realize that you may be billed for charges that are over our allowable amount. That's referred to as balance billing. A little bit about the network of contracted providers that you have available to you. Within the Albuquerque area, we do contract with the Loveless Health System. That includes all of the Loveless hospitals, including the Loveless Medical Center, the Westside Hospital, the Women's Hospital, as well as the Westside Hospital. And you do have access to contracted facilities throughout the United States. Some of our more well-known facilities that are part of your Blue Cross network include the Mayo Clinic. In the Albuquerque area, our largest physician groups include the Loveless Medical Group as well as Optum. If you are needing assistance in locating a new provider, you are always welcome to go online to your dedicated Blue Cross Blue Shield APS webpage at bcbsnm.com/APS, or click on doctors or hospitals. Or you're always welcome to contact your concierge teams through Optum as well as Loveless to assist you in locating contracted providers. We do have those dedicated telephone numbers listed below if you are interested in utilizing that concierge service. In a moment, we are going to talk a little bit and show a video about how to look up new providers by either going online, again, through our Blue Access for members. But first, let's talk a little bit about the benefits that are available through Blue Cross Blue Shield and the Albuquerque Public Schools plans. I'm very pleased to announce that there are I don't want to say limited changes, but there are very nice enhancements to the plan. Many of the common services that you have been receiving today are remaining unchanged. So you will continue to have a predictable copayment amount for your primary care and your specialist office visits. Those are $30 and $60. Again, remembering for your specialty care, there are no referrals required. It is open access, no referrals. So we encourage you, again, to maintain a relationship with that primary care physician, because they are most familiar with your care as well as your history, and they can help guide you if you are needing assistance from a specialist. But I'm really pleased to share that there are many services that are actually at no charge to you, as well as the deductible waived. They include your preventive health services. Those are your annual exams, your well child care. For us females, our well women visit, as well as annual exams for gentlemen and their physicals, as well as virtual visits. Through the epidemic, we have seen a very large increase in utilization of virtual visits and telehealth services. MD Live is the service that we have available to you at Blue Cross Blue Shield. You have access to a contracted provider 24 hours a day, 7 days a week through MD Live for both medical as well as behavioral health, and there are no charge for that service. So we encourage you to utilize it, and in a moment we're going to talk a little bit further on how to access that care. But I'm really pleased to share with you that APS, effective January 1st, for all of your behavioral health and substance abuse, office visits, outpatient, as well as inpatient services will be covered at 100% with no charge to you, as well as your deductible waived. We're really pleased to see that enhancement to the plan for this upcoming year. And we're going to talk a little bit in a moment about behavioral health, especially during the recent changes in our community, as well as our environment, as well as a result of the pandemic. Another change that I would like to highlight to you is your allergy services. For office visits for allergy testing and treatment, you will have a $60 copayment for visit, as well as for your allergy extract preparation, serum, and injections. There is a $10 visit copay per visit as well. So again, that is a change for this upcoming year that I would like to point out to you. Your labs and x-rays continue to have a $30 copayment, as well as your advanced radiology, $120 copayment if it's at a freestanding facility, and 20% coinsurance remains the same if it is taking place at a facility such as a hospital system. In addition to that, you always have access to emergency and urgent care. Excuse me. You'll notice that urgent care maintains a $75 copayment, as well as emergency room at $450. Please excuse me for a moment. Thank you. You will notice that your copays for emergency care as well as emergency room will be the same if it's out of network. So if you are traveling, or even if you're here in Albuquerque, if you have an emergency, please go to the nearest facility. You will always be covered in network for those services. If you don't mind, I'm just going to take a moment to get a glass of water. It seems like I am having a little coughing fit. I don't know why, but just a moment, please.
No worries, Lisa.
Thank you. I don't know what it is.
It's okay.
Are there any questions about benefits before we move forward to some of the plan features? I apologize. I'm only seeing my screen, so I can't see if there's anything in the chat box or anybody has their hands raised. So Becky, I appreciate your assistance if there is anything. If not, I will go ahead and continue.
Thank you. We will absolutely let you know if there's a question. Thanks, Lisa.
Thank you. As I had mentioned earlier, you do have coverage for telehealth services as well as virtual visits. It's important to realize that many physicians within our community have recently, in the past year to 2 years, they have been providing telehealth services. So a telehealth service is an online visit similar to what we're enjoying today for our meeting with your current primary care doctor or a specialist. Many of you may have experienced that over the past year. You continue to have that coverage available to you. But you also have available to you our MD Live network of physicians. Again, you're able to seek services from a contracted provider anytime, anywhere. And they're able to assist you with common ailments such as allergies, anxiety, asthma, cold and flu, stress management. So again, not only is it available for any type of minor ailment, we also have behavioral health services available to you 24 hours a day through MD Live. And once again, those services through MD Live are covered at 100%. So there's no out-of-pocket expense for you. We encourage you to activate your MD Live account. That way, if you are in need of those services, you're already registered. Just like as if you were seeing a new physician, they're going to ask you for some of your medical history, allergies, for instance. And that way, you're already set up and ready to go when you are needing the service. You can go call MD Live as well as go online to register. It's important that I point out to you that when you are utilizing MD Live, your MD Live virtual visit physician is going to be contracted within the state that you are calling from. So maybe perhaps it's during the summertime and you're on vacation and you're calling from California. That physician is going to be contracted in the state of California. That way, if you do have, let's say you have a case of pink eye or a child does, they're able to e-prescribe a prescription to your local pharmacy for pickup. So again, I encourage you to utilize the system. MD Live is a great resource available, again, 24 hours a day, 7 days a week. If you prefer to call MD Live, you're able to do that. The MD Live telephone number is on the back of your ID card as well, and you are able to speak with the health service specialist to get you set up for the service, as well as you're actually able to schedule a visit as well if you're not interested of just going online and waiting in the queue. I will let you know that those queues for a physician to meet with, our typical wait times are between about 15 minutes. So it's not that you have an extensive amount of time, but perhaps you are seeking services for behavioral health and you've met with a therapist that you've really engaged with and you think is appropriate for you, you're actually able to schedule an appointment with that same physician or therapist for future visits. So once again, I encourage you to register today for MD Live. The telephone number is in the back of your ID card, or you can also go through your Blue Access for members. Another resource that is available to you is through our 24 hours a day, 7 days a week nurse advice line. Once again, the telephone number to our nurse advice line is available on the back of your ID card. And not only do you have access to a registered nurse for any questions, but you also have round-the-clock health and wellness advice, as well as the audio library with over 1,200 different topics available to you at any time of day. Once again, the nurse advice line is covered at 100%, so there's no copay associated for the service. Customer service. Our customer service department is located in Albuquerque, so we're New Mexicans assisting New Mexicans. They are familiar with your APS benefits, as well as the physicians and hospitals within our community. They are available to you to assist you with any claims questions you may have, benefits, identifying and locating contracted providers within the community or throughout the United States, as well as questions in regards to membership and eligibility. If you're needing a new ID card, they're able to request those for you and provide a temporary card to you, as well as provide you information about any of our health and wellness education programs. Once again, they are located in Albuquerque, New Mexico. They are a designated team that are trained specifically in your APS benefits. Once again, the telephone number for our customer service is located in the back of your ID card. Before we get on to some of our online tools and resources, is there any questions that you have today in regards to the benefits themselves? Okay. If not, I just want to share with you a really short video talking a little bit about all of our online resources and tools to help address questions that you may have throughout the year. Let's make sure my
It should come up, but you might just have to toggle over to share that screen once it does.
Oh, okay.
Yeah, you'll have
You're not
to-
seeing it?
No, you just need to take it to that tab and then hit share this tab instead.
Okay, so I'm going to stop. Sorry, guys.
Okay.
I'm going to start over.
Couple of click-throughs on this one.
Just a moment. I am not familiar with this soap.
That's okay. So when you go to present again, go to a tab and then just click the tab that has your YouTube video on it.
Okay, I got it. Thank you. Share a Chrome tab. There we go. I will learn this.
No, it's okay. They're all different. That's the problem.
Are you seeing my screen now?
Hi, I'm Vanessa, and I'm meeting with the Blue Cross and Blue Shield advocate to find out where can I go if I have questions. It seems like there's a lot of important information to know about health insurance. Where can I go to learn the ins and outs?
Knowing how your health plan works can really help you save money and make the best use of your benefits. We have several online tools you can visit to get up to speed. Log into your Blue Access for Members account on our website. You can see the details of your plan, like your copay, coinsurance, and deductible amounts. You can also review your claims to see how much you might owe your doctor, or print a temporary ID card. Depending on your account, you could also receive estimates on healthcare services. Plus, there's educational content about health topics.
That's all useful. I'm on the go a lot. Do you have a mobile app?
Yes, you can find it on iTunes or the Google Play Store. In addition to viewing your claims and coverage information, you can use the app to find doctors in your network or see your member ID card information.
Oh, good. I can see myself using that. So I've got the website, Virtual Assistant Ask Ivy, Blue Access for Members, and the mobile app. Is there anything else I need to know about?
There are a few more places you can go for answers. We have a series of videos on YouTube to learn about insurance basics. You can also check out our Facebook and Twitter pages for tips on healthy living, or if you want to engage with other Blue Cross and Blue Shield members, visit our Connect online community.
Thanks. It sounds like I have plenty of options if I want to learn more. I'm going to add the app to my phone right now.
If you recently purchased one of our plan options and need more information, log into your Blue Access for Members account or visit the Member Services tab on our website at bcbsnm.com.
Okay. I hope you enjoyed that video. I'm going to go back to my, just a moment.
Yeah, it just takes a second for it to come up again. You just have to go back down and share that other tab.
Okay. It's not letting me. I apologize. Are we back on?
Yes, you are. Thank you.
Okay.
It's all good. Thanks.
So as the video explained, Blue Access for Members is really your member portal to all things Blue Cross Blue Shield. Through Blue Access for Members, it is a secured portal. It is available to you directly at bcbsnm.com/APS. And because it is a secured website, you're going to log in with your user ID from your ID card and set up a secure password. Once logged on to Blue Access for Members, you can check claims history, view your explanation of benefits. Something that we are seeing more and more is that individuals opt out of receiving explanation of benefits in the mail and only receive electronic notices. That is great for our own organization as well as for the environment and saving paper. But in addition to that, you're able to request new ID cards, download a temporary ID card, as well as be able to locate contracted providers within your community or wherever you may be traveling. In addition to that, this is also going to be the gateway to all things wellness, including your wellness programs, discounts, and nurse line. And lastly, but most importantly, it also includes your provider finder to locate contracted providers within the network. A little bit about, again, you're going to sign in through bcbsnm.com and log in with your ID and a secure password. And once in the Blue Cross Blue Shield Blue Access for members, you're able to navigate and look at your coverage, reviewing benefit details, your claim center where it's going to house all of your explanation of payments, My Health to gain access to various topics regarding health and wellness, as well as all of your coaching services and self-directed care, provider finder to locate contracted providers, as well as forms and documents such as if you're seeing a non-contracted provider, you'll find a claim form located under forms and documents. As I'd mentioned, accessing our provider finder through Blue Cross Blue Shield's Blue Access for members, you're going to log in and click on Doctors and Hospitals tab to select and locate contracted providers, again, within our community or internationally or throughout the United States. I highly encourage you to download either through the Apple Store or through Google Play our Blue Cross Blue Shield of New Mexico mobile app. If anything, you're always going to have access to your provider finder on your smartphone, as well as a digital ID card for wherever you go. Let me close this out. Inside the provider finder, you're able to look up, in addition to contracted providers, you can also use our cost estimator to look up expected out-of-pocket costs for over 1,600 specific procedures. So you're able to shop and compare. Maybe it's an MRI and you have a number of different freestanding facilities, maybe in the Albuquerque area. You can see the estimated cost for those services dependent upon the provider that you select. So you'll notice that on the next page, for instance, on this example, they're looking at an ambulatory diagnostic center, which is a freestanding center, as well as compared to Fagler Diagnostic Center. You'll see that it'll provide you the estimated cost at either facility. So it's a great tool to utilize, especially for perhaps surgery services where you do have a deductible and coinsurance. As I had mentioned, I encourage you to download our mobile app. You're going to have at your fingertips your provider finder, as well as a digital ID card available to you at all times. So a little bit about our health and wellness. Not only do you have access to contracted providers throughout the United States as well as internationally, we do not only want to be there whenever there's an illness or an injury, but we also want to provide you tools and resources to be able to get healthy and keep you that way. So the first thing that I would like to share with you is our new Learn to Live digital mental health service. This is new, available to you January 1st. It's an online program at no additional cost to assist you with any type of stress, anxiety, depression, social anxiety, insomnia, as well as substance abuse are just a few topics that is available to you. This service, again, is at no cost and available to you as well as your family members age 13 and older. We do have bilingual services, both English as well as Spanish, as well as coaching, personal coaching by phone, text, or email. So we encourage you, once again, that portal to all things Blue Cross Blue Shield is the Blue Access for members. You will get started by doing a mental health assessment by logging on to Blue Access for members and choosing wellness and then finding the digital mental health service. Again, Learn to Live. It's a great service. It's available to you effective January 1st. Also available through that member portal is our Well on Target. Well on Target is our wellness program. It includes health assessments, digital self-management programs, as well as tools and trackers, and our fitness program that I'm going to talk about in a moment, as well as our Blue Points program. Our Blue Points program is a great service that rewards you for healthy activities that you are probably doing already today. You're able to track your walking, gain points. Maybe it's your annual exam or going in for your mammography. You're able to gain points, Blue Points, and exchange those Blue Points for a multitude of different items through the Blue Points program. A little bit about our fitness program. Many individuals are not aware that through Blue Cross Blue Shield, you have available to you the fitness program. This fitness program provides to you a network of gyms, not only here in Albuquerque, but throughout the United States. So maybe you're traveling, you're able to utilize your fitness program access card to be able to seek services or join a gym or seek participate at a gym wherever you go, as long as they're contracted through that network. You'll notice that there are different levels available to you as well. That makes the network available to you to fit your budget as well as your preference. You'll notice that there's a digital only program. This provides you online fitness classes for only $10 a month. There's no contract associated with the program. It's a month-by-month service. So you can join monthly for digital only. There's a base, core, power, as well as elite program. And you'll notice that your network size increases based upon the plan option that you select. Right now, during the month of September, the initiation fee for our fitness program is being waived, but typically it is a 19-month enrollment fee, and then you just have your monthly fee based upon the program that you elect to join. We also have available our Blue 365 member discount program. Many of our partners are available to you at a discounted fee. For instance, I didn't realize that Skechers was part of our Blue 365 discount program. And when I go to my local Skechers outlet, I present my Blue Cross Blue Shield card, and they give me a discount just for being enrolled with Blue Cross Blue Shield. So I encourage you to make yourself familiar with the vendors that participate in that program just for being enrolled with Blue Cross Blue Shield. In addition to that, if you are pregnant or planning on getting pregnant, I'm sure you have many questions. We want to make sure that you have resources available through our Ovia Health apps. It is an app that is available to assist you in tracking your cycle, your pregnancy, as well as your baby's growth. There's self-guided courses available to you, as well as nurses that are available if your pregnancy is high risk, or maybe you just have questions with the pregnancy. We want to, again, make sure that you have the resources available to you to ensure that your pregnancy stays a healthy one. And last but not least in our services is our Wonder Health. Wonder is a metabolic syndrome reversal program. It is an online programming coaching service that gives you access to behavioral health skills. Again, not a diet, but behavioral health skills to promote long-term weight loss and risk reduction. I encourage you, if you haven't or don't know of an individual that maybe's participated, to enroll today, and you're able to learn more about the program by going to wonderhealth.com/APS. This great program is available to you, again, as part of being a Blue Cross Blue Shield participant, and is at no out-of-pocket cost to you. With that said, I really want to appreciate your time this morning and enjoy your day. And we really appreciate you participating as a Blue Cross Blue Shield member. I'll be happy to answer any questions that you may have.
Thank you so much, Lisa. And I just want to point out to people, Wonder Health is formerly Naturally Slim. I believe it's a more enhanced program. And it is a weight loss program for those of you who might not be familiar with the term metabolic syndrome. And it is a really excellent program that we offer employees. Carolyn, do you have a question?
Hi, yes. Good morning. I got in late, so you may have covered it. I don't know. So, my husband has insurance through his company, right? But if I want to also carry him on my insurance, he would have double insurance. Now, is there somewhere a page or something that shows how much would be covered?
I would be happy to address that, Carolyn.
Okay, thank you.
It is dependent upon the plans itself. Your
Okay.
husband's carrier is going to be the primary payer.
Yes.
On most insurances, standardly, for most programs, it's not of, I would say 15 years ago, you would have a program that covers you in full, meaning that your husband's insurance pays first, and then say your coverage would pick up any remaining balance.
Yeah.
Within the last probably 5 to 10 years, those coordination benefits have changed,
Okay.
and they have evolved to what is called a maintenance of benefits. So with the maintenance of benefits, your secondary coverage is only going to pay up to what they would have paid as if they were primary. So say, for instance, your husband's co-payments are $10, or excuse me, are $20, and under APS, say they were $10.
Yeah.
We would only pay that additional $10, so that you would have only been responsible for that dollar amount. They no longer cover you or make you whole. So I encourage you to really take a look at what premium you would have paid to cover your spouse under the program, because many times the premium associated with that dual coverage outweighs any cost savings that you would have achieved through coordination of benefits.
Yeah, and then he has Blue Cross Blue Shield,
Mm-hmm.
So I was wondering, and I used to carry him before.
Uh-huh.
And
And what was your experience? Did you find that many times, because again, it's evolved through the years, and many times that premium that you're paying for his coverage far exceeded any additional benefits that you gain from having the dual coverage?
well, no, actually it was that it really helped him a lot. He didn't have to pay quite as much.
Mm-hmm.
Yeah.
Can I ask a clarifying question, Carolyn? Are you referring to having him drop the insurance where he is, and then you add him as a dependent, so you're both covered together under the APS plan?
No.
Or you specifically mean he's going to have insurance with his provider, and then you want to add him as a dependent as well?
Yes.
Okay.
Yes. So I was wondering, what are the benefits of that? And because before we used to have that, so his out of pocket was really very low. It was really very low. But then I took him off. It's like, you cover your own insurance.
I hear you. Yeah, I encourage you to take a look at the premium that's associated with adding his coverage, and really take a look at that, because again, the coordination of benefits rules have changed throughout the years, and many times it's not a cost savings as it was or has been in the past.
Okay, and where can I find any information on that, on coordination of benefits? Is it written somewhere so that I can download it and study it a little?
So you want to look at the premiums, and so we have a comparison grid and the premium payroll deduction sheets. I will put the link in here, but that is on the aps.edu human resource benefit page. It's already up, and I will give you the link, and so you can look at what those premiums are.
I think it would be like $100 extra, right?
I don't know. You really need to look and see if
I did look at it, and I told him, well, instead of me paying the 100 something, I'm going to pay 200 and something, right? And but I was just wondering, is that payment out going to benefit him? That's,
And Carolyn, once you have an opportunity to take a look at the premiums as well as the APS benefit guide, if you have any additional questions, I am available. If you would like to take my number down, you're free to
Okay.
give me a call.
all right, I will. Thank you.
Yes, I have no problem with that.
Thank you,
Yeah.
Lisa.
You're welcome. It's area code 505. I'm here in Albuquerque.
Okay.
505 816
816
4096.
4096.
Or I'll also give you my additional telephone number because quite often I am out of the office and we never know when we're out or in based upon the current pandemic. So I'm going to give you my cell phone as well. It's
Okay, thank you.
505-507-6765.
507
6765.
Thank you.
Yeah, I encourage you use my cell phone
Okay.
because I'm more readily available there.
Yeah. So, yeah, because he's going to have an upcoming surgery, right? And I'm thinking, would it be to my benefit, to his benefit, our benefit, to have a double coverage? And is it worth it? Those are questions. But I need to then look at it, and I will.
Yeah, and what'll be difficult again is because it is a surgery, it's going to be a deductible and co-insurance.
Yes.
And so dependent upon what the surgery is and the fees associated with that, again, the APS plan is only going to pay up to what they would have paid if they were primary. So if our allowable amount was $1,500 and his primary insurance paid $1,600, we're not going to pay anything additional.
Yeah.
Because so again, it's best to do as much research as you can in regards to that.
Yes, I will. Thank you. And now this is the other thing. Now, if his insurance is also with Blue Cross, because before I used to have a different insurance, right? I used to have Presbyterian, and so oh darn, can you hear me?
We can hear you.
Oh, okay, because I keep saying
Busy
that the
network
connection was
connection.
lost and to dial in.
We could hear you.
Yeah. So anyways, all right. So I now have the Blue Cross and he has Blue Cross.
Such things.
So, yeah, there's just a lot of questions about putting him under me as a,
And again,
I will.
feel free
Okay,
to
thank
contact
you.
me.
And then if we have any
Okay,
other
thank you.
questions, I'm going to just give some closing reminders and then we will stop recording. And then if there are additional questions, we're happy to take those for you as well.
Okay, thank you.
Sure. Carolyn, thank you. So we are just going to give a couple of closing reminders for everybody. These presentations are going on all week. With other benefit providers as well. And your Davis Vision and Delta Dental are tomorrow. And ASI Flex medical spending account presentation is Friday at 7:30, bright and early. We want to remind you that our open enrollment is completely online again this year using Winocular. We have another webinar to assist you through that process on Tuesday, October 5th at 3:30. All of these webinars are recorded and they're placed on our APS Employee Wellness YouTube channel, so you can access those there. And we also encourage you to come to the APS Employee Wellness Fair Thursday, October 7th between 8 and 3:30 at Bonifacio. If you have any additional questions, Lisa will be there, as well as other Blue Cross Blue Shield representatives. And we also will have our benefit specialists on hand and some laptop stations. So we will also have some assistance for you through this open enrollment process with Blue Cross Blue Shield and our medical and non-medical carriers. We're going to have mammograms. We're going to have vaccinations. We're going to have a blood donor drive. We also have lots of community wellness companies and other community nonprofits coming. We have a mini farmers market. We're going to have fitness demos. So it's going to be a jam-packed, really fun day and very safe and socially distanced. So we invite you all to come to our wellness fair. We're also going to
Come visit me.
Huh? Yes, come visit Lisa.
I said, come visit me.
Actually, in the Blue Cross Blue Shield area, not only will Lisa be there, but our wellness coordinator, and she's going to have a really fun brain game as well as a stress meter. So most of our activities there are interactive, so we do encourage you. I'm looking forward to the brain game. I have a feeling I'm going to fail, but we do encourage you all to come. And we want to also encourage you to connect and engage. The topic this year is your benefits engaged. We want you to engage in your wellness and your benefits. And you can do that by knowing where your resources are. We continually post things on Facebook, Instagram, Twitter, and YouTube. We have monthly wellness newsletters. We also put out every other week in the Perspective. We have the Employee Wellness Google event calendar, as you know, because you logged into this session today. But we also have pretty extensive information in the APS intranet, including resources under Blue Cross Blue Shield specifically. And we also have the aps.edu Human Resource Benefits page, which also has a wealth of information for you to know your benefits and your wellness resources. So we encourage you to engage with that and stay healthy for yourself and your family. And with that, I will say thank you. Again, the main employee benefits website is right there. And then we also have a central email that you can reach out to if you have any questions. I'm going to stop recording, and I want to thank you all for joining us for this awesome Blue Cross Blue Shield presentation. We appreciate you coming. And with that, I will say adieu. Thank you.
Yay.
Take care.
Have a great day.